The inflation that we've experienced throughout our country in the last couple of years has impacted all of our lives, including healthcare premiums. There are some people today that are looking at going with Plan Ns to save money. In this video, we're going to explore that as an option to see if this would be a good choice for you or not. I want to begin this video by talking about the things that Plan G and Plan N have in common, because there are several items, then we'll look at the differences after that. But number one is when we have a Plan G or Plan N, we are in the traditional original Medicare system. So as long as we have a provider that takes original Medicare A and B, they will always take your supplemental plan, regardless of what letter that is, G or N, and regardless of the carrier that you have selected. And this is one of the beauties really of all supplemental plans, is we have no networks whatsoever. We actually call this system open access. Open access. Now, when we compare this option of being on a supplemental plan versus an Advantage plan, Advantage plans always have networks. Majority of them are HMOs and some PPOs as well. But again, in G or N, we have no networks. We don't have HMOs. We don't have PPOs. You can actually go to any provider as long as the provider takes original Medicare. Number two, no referrals. So if you are desirous to go see your cardiologist, or you want to see a dermatologist, or a lady would like to go to an OBGYN doc, you do not have to have a referral from a primary care physician to see that specialist. Now, there are some times, frankly, where specialists will not see you unless there's another doctor involved, but the original Medicare system with supplemental plans never will require a referral from a primary care physician as Medicare Advantage HMOs would. All right, number three, also we have no pre-authorizations. Now, pre-authorization means this. The doctor says you need an MRI or a CAT scan or a PET scan. Doctor says you need a hip replacement or a knee replacement, or you're in a skilled nursing facility and we need an extended stay in that skilled nursing facility. But in order for that to be covered by the insurance company, a pre-authorization says that the insurance company must agree with the doctor's recommendation and actually approve that before you're going to get that service, before you get the MRI or the CAT scan or the knee replacement. And so in the Medicare Advantage system, we always have pre-authorizations that are mandatory. Now, not on every service for sure, but on many services. And so in Medicare Advantage, we have pre-authorizations, but when we have a supplemental plan, that insurance company that you chose for your G or your N plan will never put any extra demands upon you. In other words, there's no hoops to jump through because there's no pre-authorization right by the supplemental company. They follow Medicare. So if Medicare says they'll cover a service and the doctor says that you need that, end of story. Insurance company cannot intervene, cannot interfere, cannot delay, cannot deny, as could be the case with an Advantage plan. So that's a wonderful feature. And then number four, when we get a supplemental plan, number one, it's a lifetime policy. It is written for life. We call that guaranteed renewable. As long as you pay your premium, you can never lose that policy. In other words, the insurance company can never cancel it except for non-payment of premium. The second feature with a supplemental plan is it's a national plan. It's a U.S.-wide plan. In all 50 states, you have the same coverage. When you pull out that red, white, and blue card and you pull out your supplemental card, whether you're in Miami, Florida, or you're in Seattle, Washington, there is no difference whatsoever. It truly is a national plan. And then thirdly, it's also a portable plan. So let's say you live in Miami, Florida, and you decide to move to Seattle, Washington. You actually can take your supplemental plan with you. Why? Because it's attached to you. The only thing that can change when you move, and it will happen occasionally, is they can change the premium. Could go up a little bit, could go down a little bit. But the point is, it is your lifetime policy, totally portable. Now, again, we compare that to Advantage plans. Advantage plans are 1 year at a time. It's a calendar year. They're not national. They're going to be more of a local network type of a plan, and then certainly not portable. If you move from one area to another, you're going to have to get a different plan. So again, these are the four main features that really make supplemental plans so attractive, and regardless if I have a G plan or an N plan, I'm going to have these features. All right, now let's talk about the differences between the G plan and the N plan. First off, you'll notice that the Plan G today is the most comprehensive plan that's available. Now, those people that were actually starting Medicare before January 1, 2020 actually could have got an F plan. Now, that was the most comprehensive plan that was on the market. But if you're starting Medicare after January 1, 2020, then the F plan is not even an option for you. I just simply mention it because this used to be the most comprehensive plan. So if we're starting Medicare after 1/1/2020, the G plan is most comprehensive, which means it carries the least amount of risk. So there are people that say, hey, I want the best coverage I can get, the most comprehensive, then that typically is going to be your G plan. Then we talk about the N plan is this. Now notice the way I worded this. The N plan is slightly less comprehensive. It's still very comprehensive, but less than the G plan, all right? Meaning you're going to take on a little additional risk. So there's more risk with the plan. Again, I'm not talking about a huge amount of risk, but again, as we compare these two plans, you got to realize that's going to be the differences. And of course, there's other differences as well, but I want to focus basically on this slide with talking about the comprehensive of the coverage. This is very, very comprehensive. This is still comprehensive, but just not quite as much. All right, so let me use this Medicare grid to explain what I was just talking about in a sentence form. So here's what we call the Medicare grid, and what this shows is the original Medicare system and the gaps that exist in that system. I'm not going to go through all this other than just to point them out, that you'll notice the A side of Medicare, which is that inpatient side, hospital, skilled nursing facility, hospice, those kinds of services are covered by Medicare A. So basically, this is your inpatient side of Medicare. Your B side is going to be your outpatient. All right. So not only is this the outpatient side, but it's also where all the doctor services are covered on the B side of Medicare. So outpatient would be your labs, your MRIs, your knee replacements, those kind of things, but also all the doctors that take care of you, whether they take care of you in the hospital or they take care of you in an outpatient setting or you go to their office to see a primary care or a specialist. It's always the B side of Medicare that's going to cover the doctors. So we have everything outpatient, and then we have all of our doctor services over here on the B side. And so my point is this: we have 3 gaps on the B side and we have 3 gaps on the A side. So on the A side, it means I'm in the hospital. My first gap is a deductible. Now, by the way, I'm shooting this video. It is election day today, November the 5th of 2024. We are still waiting for the 2025 numbers. So I suspect these will probably, some of these will go up a little bit, but it'll be very close. But for now, if I go to the hospital, it costs me $1,632 out of pocket, and that's all I have to pay for up to a 60-day hospital stay, which is going to be about 99% of every situation, okay? So we have a small deductible. Now, that deductible is not annual. It can happen multiple times in a year. So if I'm hospitalized and I go home, I'm discharged, and I'm discharged more than 60 days. And then if I'm rehospitalized, I go back to the hospital and I would owe that deductible again. So again, it's not annual. It's tied to what we call benefit periods. Now, that's all I have to pay for up to a 60-day stay in the hospital, which is probably 99% of every situation. But occasionally, people are in the hospital longer than 60 continuous days. So what happens is I get into these extended hospital stays. Now I have an additional out-of-pocket expense beyond that deductible. So you'll notice this is month 3. I have to pay $408 a day. Month 4 and month 5, I have to pay $816 a day. So my point is that is our second gap that we see in Medicare Part A, extended hospital copays. And then we have the last item that represents a gap in Medicare, and this would be for skilled nursing facility. This is sometimes after a hip replacement, after a stroke, maybe an injury or an accident, a fall, someone has to have intensive rehab, they're going to go to a skilled nursing facility. Here's the rules. Medicare says the first 20 days, notice, doesn't cost you a penny. Now the rule that's attached to this full coverage is you've got to be in the hospital at least 72 hours or longer before Medicare will pay skilled nursing. So if we have that 72-hour stay or longer, Medicare pays everything the first 20 days after that. If I'm still in need of care, Medicare covers me for 80 full days, but now I have to pay a daily copay from days 21 to 100. Right now, the average stay is about 35 to 40 days. So most people are spending out of pocket about $3,000 to $4,000 with that particular gap. All right, so those are the gaps on the A. Gaps on the B, we have a deductible. Now this deductible resets every January. This year it's $240. I don't know for sure what it'll be next year. It'll come out soon. But this deductible is not like this one. Remember, this one can happen multiple times in the year. This can only happen once in a calendar year. So whenever you start your Medicare, if it's January, it's $240 for the year. If you start in July, it's $240 for the year. They don't prorate that. So it's a calendar year deductible, resets every January. So after I've met that deductible, then I get into my second gap on the B side, and that is called coinsurance. Medicare on the B side is an 80-20. So if I have labs, I have an outpatient surgery, I see a doctor, I have a surgery, all those physicians and everything outpatient, Medicare pays 80%, I pay 20% of the bill. We call that coinsurance. So Medicare doesn't cover anything 100% other than preventive. So your out-of-pocket expense on this side would be 20% coinsurance. The last gap is called an excess charge. I'm going to elaborate on this one here in a few more minutes, but I want to clarify it here as we talk about our third gap. This is when a physician adds 15% to the bill. And again, I'll give you the details. But whenever this happens, Medicare allows the doctor to do it, and you have to pay that. So those are the three gaps on the B. So as we look at this grid, we have a total of 6 gaps. So if I had that F plan that I talked about earlier, if I was born before if I started Medicare before 1/1/2020, then I could have actually full coverage. All these gaps would have been filled in. But that's not a possibility for most. So let me show you exactly how the G plan is going to work as it relates to these gaps. Hey, if you found this video helpful and if you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, so here's the grid without my scribbles, and if I had that G plan, and again, we said this is the most comprehensive plan for people starting Medicare after 1/1/2020, it's going to cover in 5 of the 6 gaps. So the only thing I have to be out of pocket will be whatever the Part B deductible is. And again, that'll probably be a little higher in 2025. But you pay that once a year and then you're done. So the first $240 or whatever that number is that's going through the B system is going to end up as a bill in your mailbox. Could be 2 or 3 doctor visits. Could be $240 of an MRI or $240 of a knee replacement. Anything outpatient, you pay the first $240. After that, we have 100% coverage. So as long as you're seeing a Medicare provider and getting a service that Medicare says they'll cover and you have that G plan, that's all you would spend beyond your premium. All right, now let's look at how the N plan is going to work. Again, I take on a little bit more risk, a little bit less comprehensive, but still very, very good. So what the N plan is going to do is this. It's going to cover 4 of the 6 gaps. Like the G, you have to pay your B deductible, but unlike the G, what happens with the N plan, you are now responsible for that 15% excess charge if and when that is going to occur. Okay, so again, G covered it, N is not going to. In addition to that, what we have a couple of copays. So we're responsible for excess and we have copays. So we have a $20 copay if we go to a physician. It's up to $20, could be $18, could be $16, but no more than $20 every time I see a doctor or a specialist. And then if I happen to go to the emergency room and I'm not admitted to the hospital, then they charge me a $50 copay to go to that ER. All right, and again, take on just a little bit more risk, excess as well as some copays. All right, so I want to spend just a few minutes really elaborating on excess charges. Okay, some facts about excess. Number 1 would be this. The amount of an excess is actually 15%, and that is the most that the doctor can add. Okay, and again, what happens with excess, this is a doctor that there's a couple terminology. This is a doctor that is what we would refer to as a non-participating doctor. Now, when we say participating doctor, that is someone that will agree to take what we refer to as fee for service. So Medicare has a predetermined fee for everything they're going to cover. That doctor knows exactly what they're going to get paid. And so the great majority of doctors actually will accept that fee-for-service scheduled payment as payment in full. We also refer to that as a doctor that takes assignment. Okay? They'll take exactly what Medicare says they're going to pay for it and nothing more. But what happens is there are some doctors that do not take assignment. They're non-participating doctors in that fee-for-service schedule, and they're going to add to the bill. And, of course, the most they can add to the bill would be 15%. All right, so that's the excess charge. And as we saw, G plan would pay it for you. The N plan, you'd be responsible for that. Now, let's talk about the frequency of this, okay? Now, there's different numbers out here, but for sure we know this is very accurate. Less than 5% of all doctors that take Medicare patients and are involved in the Medicare billing process are going to add the 15%. So it is very, very rare, frankly, but definitely less than 5%. Okay, so that's why I said earlier, is there a whole lot more risk with the N versus the G? No, but it still does happen. And we see this basically in the cancer field in certain specialties where they're going to add that 15%. But again, it's still, as a general rule, across the board, all doctors less than 5 are going to do this. All right, so the last aspect of excess charges I want to deal with would be the exceptions to the rule. In other words, there are some places that will not allow excess charges to occur. And this would be a state that has this law says no access. And so we have exceptions. There's actually 8 of these states. The first one would be the state of Connecticut. They do not allow excess. And then Minnesota, no excess. Massachusetts, again, no access. And then we have New York. Now, when it comes to New York, I want to clarify something. What happens, there are some services where they can actually add excess, but the limit's 5%. And other services, they can actually go the full 15%. Okay, so they're kind of unique when it comes to access. But again, no excess, and then some here for sure. And then the state of Ohio, no access. The state of Pennsylvania, no access. Rhode Island, no excess, and then Vermont. So we have actually 8 states, 7 of those, no access whatsoever. And then New York, of course, was that exception, somewhere between 5 to 15%, depending upon the service. All right, so here's my point. If you live in a state like this, where they can't have excess charges, you go to physicians there, you'll never see the additional 15%. Now, if I happen to live in Connecticut and I go to another state to get services, then I could still be charged excess. So it doesn't protect me from excess across the country, just in the state where I reside. Now I want to talk about the 2 reasons why some people are actually choosing a Plan N. Again, I say some because 70% choose Plan G, 30% are choosing Plan N. But here's the reasons. Number 1, to lower their monthly premiums. That's very obvious. You'll see here in just a few minutes, that is going to vary across the country from state to state between the difference between that G plan and the N plan. So some people are willing to take on that a little additional risk on the N plan because, again, they're going to lower their premium. All right, the savings is worth it to them. And then secondly, a new block of business. Now I want to specify something here. Lower monthly premium would apply whether you're getting an N plan initially right at 65 or when you retire, or if you decide to switch plans. Okay, so when we talk about switching, what I mean here is you had that G and are moving to an N, or maybe you're on an N plan and you're just moving to another company's N plan for a lower premium. And so when you're switching these plans, what happens is you are going to enter into a new block of business. It's like you're resetting the clock, because when we buy a supplemental plan, what happens is we go into a block. We would call this a group of people, usually within about a year to 18 months of the time you bought your plan. And so there's thousands of people that are in that group. And so what's happening is this: everyone that's in the group pays in their premium, and of course the company has to pay money out in claims. All right, and so money goes in and money goes out. So here's premium, and this when claims would actually exceed premiums, what happens? That means that block is losing money, and then that's when we're going to see price increases that occur. And so what happens is this block that you were in 5 years ago, 7 years ago, 3 years ago, that block is getting smaller. Why? Well, people pass away. People switch plans. So that block begins to get smaller and smaller, and the net result could be rates that are not quite as stable as they were originally. And so when I say we have a new block of business, we're resetting the clock. And so if I decide to switch, what's going to happen? I'm going to go into a brand new block. Most of the people in there are going to be at 65 or 66, so it's going to be a younger block, and it's much larger. And then the net result should be more stable rates. So that's the second reason we can actually benefit from switching plans. Hey, if you've come to the place where you know you're going to have to make some Medicare decision pretty soon and you want to make the right one of the best ways to do this is to go down below, and you'll see in the comment section there, the very first pinned comment at the top. You can actually click on the link there and you will book a call. And you'll book a call with one of our Medicare guides. All the guides with our company, I have personally trained them. They're professional, they answer all your questions, and they'll show you your Medicare options so that you'll be confident in your decisions. Let's get back to the video. All right, now let's talk about the process of going on an N plan. Now, if I start off my N plan, I have what we call the initial enrollment period. In other words, you're new to Medicare, either at 65 or you retire at 67. And so what you have here is there's going to be no underwriting involved whatsoever when you first go on that supplemental plan, because during the first 6 months of our B date, the insurance companies have to take us. They cannot charge us any additional premium. They have to cover all of our pre-existing conditions. There's no health questions asked whatsoever. So that's called the initial enrollment period. Now, if I'm going to switch plans, then that 6-month period is probably well gone. It could have been 2 years ago, 5 years ago. So if I'm going to switch plans, what's going to happen? The process will involve, in most states, underwriting. And I'm sharing this with you. If you decide that you want to switch to an N plan, then you're probably going to have to go through underwriting, which means we're going to ask you probably 25 or 30 health questions. We're going to check all your medications, and that information, medical information, is going to be given to the insurance company, and they're not obligated to take you. They may, but they're going to go through that process of underwriting. And if they agree to approve the policy, then you're going to be able to switch. If they say, no, we don't like the risk involved, we don't like your pre-existing condition, then they may deny that application. Now, by the way, if they deny it, there's no harm done whatsoever, because your present policy has not been canceled. It's just sitting there, and you just continue to keep that plan. And so it doesn't hurt to try to switch if indeed we believe we can get through the underwriting process. So again, health questions, and we'll check all your medications. That's the process for switching. All right, so we've said that one of the main reasons people switch is to lower their monthly premiums. And again, we're brokers. We write in all 50 states plus DC. So I just want to kind of give you a sample of the rate differences between the G and the N. And I also want you to know I'm not encouraging anyone to make the switch. What I'm trying to do is just simply sharing with you what some people are doing to save premium. All right? And so let's go through these states. We're just going to kind of go through the country and just a sampling, and just to make sure you know, these rates that I'm quoting here are just average rates in these states based upon someone that is turning 65, and it would be a female. All right? Usually male rates are usually a little bit higher, maybe $5 or $10 more a month. But the point is just to at least show you why some people make the switch. So first off, in California, the average Plan G, and again, there's some a little lower, some higher, just simply average, about $150 a month for a female that's turning 65. A Plan N in California is going to be about $35 less a month. So what have we saved here? Well, if I moved over here to the N plan, I saved about $420 for the year. Now, what did I take on? Well, I took on the small risk of excess charges, plus I have some co-pays to go to the doctor or go to the emergency room. All right? Now, if I am in the state of Texas, a little bit lower on the G plan versus your N, now what are we saving? About $30 a month. So again, here I would have paid about $360 a year for the N plan. I would have saved. Colorado, that would be what is that? About $35 a month. So again, that's about $420 a year in savings in the state of Colorado. Illinois, about $25 a month. So that's going to give us, what is that? About $300 a year savings here in Illinois. Ohio, $120 to $180, so it's about $40 a month. So here I actually saved about $480 the state of Ohio. Now, one thing interesting about this one, remember that's one of those states that cannot charge excess. If you go to a physician there, they cannot add the 15%. All right, then state of New York. Again, that was the one that was kind of 5 to 15% excess, so it can happen, just not in all services. But notice the difference here. We're talking, what, $65 a month difference. So what is that? About 65 be 130 times 6 would be what? About $780. Is that right? So we have 65 times 12, 13 and 5 and 6. That's right, $780 that we actually saved during that year by being on the N plan. So much more attractive. And then lastly, South Carolina. South Carolina, low rates there, 105 to 75. So again, we're talking about $30 a month the difference between G and N. And so again, we saved that $360. All right? And so you can kind of see these are going to vary around the country. And then the last one would be the state of Florida. Now notice Florida's, we're talking about $50 a month difference between G and N. So we saved about $600 $300 a year. Now, here's my point. As you look at the savings, some people will say, I don't want to take on that little additional risk because that $300 a year or $480 is really not going to make or break my budget. And so if someone still wants the most comprehensive, they may be willing to pay. And so if you're on a G plan, stay on the G plan, not a problem. But if this would be very helpful in your budget to save that money, then this would make sense for you to move to that N plan to save the money, because you still got all the wonderful features of the Medicare Supplemental Plan. No networks, no pre-authorizations, no referrals. You still got that lifetime permanent policy. All right, so those are some of the average numbers of savings. All right, my last slide, let's talk about how you can compare these plans. Number one, you can actually give us a call. We have agents that would be happy to go through the different companies, the different premiums, the different stability of the rates of those carriers, and we'll get into all the details of that and actually make that comparison for you. Happy to do that. That's one of our 800 numbers. You can call toll free. We're open 7 to 7, Monday to Thursday. That's Central Time. And then on Friday, 7 to 6. So call anytime. We actually have a receptionist team. We have 16 receptionists. They'll triage the call, talk to you about what your needs are, and they'll direct you to the right department so you can make that comparison. Then we also have a tool that people really enjoy, and this is an online comparison tool. You also can actually do an enrollment as well, but you don't have to do an enrollment, but you can go on this particular tool and you can actually do all this yourself. And so there's going to be a link in the description here right below of this video. And if you go to that link, this will show you all the carriers that are in your area. You'll have to put a little bit of information in there and we'll actually shop all those. And then you can see exactly what the savings would be between the G or the N. And again, we'd be happy to assist in that process. All right. So be sure, if this is something you're looking at, take the time to make that comparison. Give us a call or use our online resource there, and we'd be happy to assist in making that switch.